Bone is a specialized connective tissue. As the general rule of connective tissue, bone is also made up of cells and matrix. There are three types of cells in bone: osteoblasts, bone forming cells; osteocytes, bone maintaining cells; osteoclasts, bone destroying cells. Bone forming cells produce cell generated secretions like collagen type 1 fibers and structureless gel like amorphous ground substance. This substance is made up of glycoproteins, example osteocalcin, osteonectin, osteopontin. Like this, all these cell generated materials are organic components of the matrix. Bone is not only rigid, it is hard. The hardness is due to mineralization, mainly calcium and phosphate, and in some amounts of bicarbonates, citrates, magnesium constitute an inorganic component of the matrix. Like this, bone matrix is made up of organic and inorganic components. What is osteoid? The matrix of the bone, which is not yet mineralized, is known as osteoid. It includes amorphous ground substance and type 1 collagen fibers. During formation of bone, osteoid is laid down first, on which minerals are added upon. What is bone mass and bone density? Osteoid or organic components of the matrix can be termed as bone mass. The degree of mineralization will indicate density. When bone mass and density both are less, bone becomes porous and easily fracturable. Example, osteoporosis. With good bone mass but less mineralization, hardness of the bone decreases. Weight-bearing long bones can bend in children. Yes, mineral deficiencies results in rickets in children, and in adults this condition is called osteomalacia. When bone is hyperdense with excessive mineralization, it results in easily breakable brittle bone disease called osteopetrosis. Yes, for a healthy bone with good tensile strength and hardness, both organic and inorganic components should be in perfect combination. This combination keeps on varying throughout life because bone is a constantly changing, remodeling, and dynamic tissue. This is longitudinal section of dry bone humerus. It shows medullary cavity in the shaft. It has compact bone here and spongy bone near the end. This shows periosteum with blood vessels, endosteum on the spongy bone and in the medullary cavity. Here is compact bone showing Haversian systems, and these canals are Haversian canals and transverse canals are Volkmann's canals. This shows transversely cut Haversian system. For understanding purpose, concentric lamellae of this Haversian system have been pulled out. Different lamellae are shown, and in between the lamellae osteocytes are present. This shows how collagen type 1 fibers are arranged perpendicular to each other in adjacent lamellae. Longitudinal section shows vertically running Haversian canals and transversely running Volkmann's canals. Within the compact bone, we see inner and outer circumferential lamellae. Inner circumferential lamellae is seen just outside the endosteum. Outer circumferential lamellae will be seen just inside the periosteum. As bone is continuously remodeling structure, in this picture, the darker osteons are newly laid osteon. The lamellae of older osteon, which are seen in between the new osteon, will form interstitial lamellae. Let us see how new osteons are formed. Imagine all these are the parts of old compact bone, and new bone is getting formed by this cutting cone of osteoclasts. So they are projecting towards the old osteons and they are breaking the bone and creating the cavity. This is the cutting cone, and this cavity is lined by osteoblasts, which go on depositing the osteoid underneath them, and that goes on increasing in its thickness and slowly closes the cavity, and finally a Haversian canal is formed in the center. All these are the osteocytes which are trapped in between the newly formed lamellae. This is the cutting cone, this is the closing cone. This is done by osteoclast, closing is done by osteoblasts. These are the outer limits for new Haversian system, and this is the Haversian canal. We will see this in transverse section now. This vascular space created by osteoclastic activity is slowly closed from periphery to center. The first layer of osteoid laid by the osteoblasts in the vascular cavity is usually not mineralized. This will form cement line. This is one lamellae which is laid, and this is a second lamellae which is inside to it, and this is third lamellae. Like that, slowly osteoblasts shift towards the center, and osteocytes get trapped in between the lamellae. This is how the Haversian canal is becoming smaller, narrower and narrower.